Good evening to everyone. Today we are going to look at determinants of health, and in this very video, each one of us will be in a position to know what determinants of health are. And before that, we shall look at the definition of health. We shall define a community, define community health, and outline the determinants of health. And this will be our video. Let's begin. We are talking about health. And health, by definition, refers to a state of complete physical, mental, spiritual well-being of man, but not merely the absence of disease or infirmity. In other words, when you talk about health, we don't only look at the body, but we look beyond the body, looking at all these aspects, the physical, the mental, spiritual well-being of man, but not mere the absence of disease or infirmity. Infirmity meaning sicknesses. So next we are to define a community, and this refers to a group of people who live in a particular area as a village or town that share common interests like resources, that is safe food and water. So what we call a community, it's a group of people, and these people live in a particular environment or a particular area, and they have things they share in common. Once we recognize that, then we are able to say that is a community. Then community health, as a next definition, we are saying it's a branch of medicine concerned with the health of the whole population and prevention of diseases. So this is a course unit. This is a bigger thing. It's a part of medicine or branch of medicine that is concerned with the health of the whole population and prevention of diseases. So now we are going to start outlining the determinants of health one by one. But before this, let's define what determinants of health are. And here we say that these are things that we do and either destroy our lives or promote them. Determinants of health, things that man does that either promote or destroy our lives. Human beings engage themselves in a variety of things, and some of them are so dangerous that they can destroy their lives, and other things they do will promote their lives. So the following are the determinants of health. One is food supply and adequate nutrition. And here we say that if there is enough food supply and people are eating as required, then they are going to have healthy lives, or their well-being is going to be promoted, and vice versa. We have the second determinants of health, which is water supply and sanitation. And here when we talk about water supply, we are saying if individuals are able to access safe water for drinking, for using in all the domestic purposes, these humans are going to have healthier lives than the individuals who are going to use sewage, swampy water, and they are sharing the water with animals. Those are likely to have their lives destroyed. So water supply being good becomes a determinant of health. Stem to sanitation, and this is the general cleanliness of the environment. If humans are living in an environment which is clean, well-maintained, they are likely to have healthier lives, and vice versa. Then the next determinant of health is land ownership and distribution. And with this, we say that humans who possess their own land, psychologically, they are stable, and they are able even to engage in agricultural activities to plant foodstuffs which are necessary for their lives because they can possess the land. They own a piece of land. Then there is these other determinants of health, which is environment and climate. And here we shall focus more on the climate. Once the climate is favorable to humans, For example, during the winter, there are people who are going to have ill health. They are going to develop asthma. So weather or climate being now a determinant of health, whether to remain healthy or to become sick. Then there is cultural practices and beliefs. These are big determinant of health. Imagine some cultural practices where they practice mass circumcision just using the same instrument. Some people can acquire diseases. So some cultural beliefs can make someone get ill health, whereas some may promote people's health. Then we talk about the socio-economic status. The income capacity a person has makes him be in a position to access social services and access the food nutrients that are responsible to build up the body so as to be healthy. Then you talk about political stability, where people are living in a peaceful place or community, and they are able now to practice all the requirements or good practices for one to live healthy. Then there is this other point of transport and communication. This is also a determinant of health, that once there is access of transport in the community, people are likely to access the services, and now transport becoming a good determinant of health. People are able to use the roads, people are able to call their friends, and psychologically they will be healthy. Remember, I've said health is more than physical. The body, mind, and soul have to be cared for. That's why I've said health is a state of complete physical, mental, social, and economic well-being of man, but not mere the absence of disease or infirmity. Now, man has to access good transport. Then the lifestyle of an individual is another determinant of health. And when you talk about lifestyle, these are the habits an individual has adopted in his lifestyle. For example, smoking, alcoholism, and many other lifestyles. Such a lifestyle are likely to injure one's health. Then an individual who adopts to a lifestyle like brushing the teeth daily, making sure that he takes a balanced diet, such an individual is going to have a good health. Then you talk about the genetic factor. The genes you inherit from the parents play a bigger role to which kind of diseases you like to suffer. People who come up with sickle cell, we shall find that such a disease is familial. So the genes that you have inherited, or the genetic makeup of a human being, makes him acquire certain diseases. Then gender. Once you are male, there are diseases for males, like prostate cancer. Once you're a female, there are conditions you're likely to suffer, like cervical cancer. So your gender can determine whether you're going to be healthy about a certain condition or not. Then you talk about the age or transgeneration. As people grow, remember the diseases you shall find in the young babies and the diseases that you shall find in adults. So age is here playing a part as a determinant of health, in that some young child will be diagnosed of physiological jaundice, which condition may never be diagnosed in someone who is 50 years. And the same will happen to this person can get dementia, which condition may not be in childhood. Why this? Age is a determinant of health. It can decide whether you are going to remain healthy or you are going to acquire a certain condition or not. Then you talk about healthcare organization. How are the health services around you? Are they of suitable quality? Are they supplied by qualified people? Remember, once you are given these health services or you reach a healthcare organization and the people are not qualified, the medication they will give you is also likely to injure health. Their practices are likely also to injure your health. So last, you are going to talk about employment, that once someone is employed, people are likely to access all the foodstuffs they want, they're likely to have a fresh mind, and they can afford to take themselves to the hospital. These are the determinants of health. So thank you for listening. I hope you will share this video and your colleague will be able to understand some